Is spasticity holding your child back? Have the effects of your child's cerebral palsy made everyday activities, like playing with friends, difficult or even impossible? As the parent of a child with spasticity due to cerebral palsy, you may be concerned about the health and well-being of your child. When it comes to your child's condition, you most likely have more questions than answers. And just like so many parents struggling with the same issues as you, your only wish is for your child to be happy and as comfortable as possible as he or she grows.
As parents of a child with spasticity, we know activities that may seem simple to most families, like getting dressed in the morning, can be a real challenge.
Most of the time we just feel helpless watching Andrew struggle. We just wish there was something more we could do for him.
We understand that seeing your child experience daily battles as a result of his or her spasticity can make you feel powerless or frightened. That's why it's so important that you become informed about the condition and approved and investigational treatment options. Cerebral palsy is a condition sometimes thought of as a group of disorders that can involve brain and nervous system functions, such as movement, learning, hearing, seeing, and mental development. Spastic cerebral palsy, the most common type of cerebral palsy, often causes one or more of the muscle groups to tighten, thus limiting movement. Many children who have spastic cerebral palsy experience equinus, a condition that limits the motion in the ankle joint. And it's not just the physical limitations that take a toll on the child. More often than not, a child's quality of life is affected, as is their independence and self-esteem. For children, spasticity can interfere with schoolwork, behavioral development, and other activities. While there is no cure for cerebral palsy, the goal of treatment is to help a child walk more easily and to lessen the pain caused by his or her spasticity. Treatments vary depending on the severity of your child's muscle stiffness. They range from non-drug treatment such as casting, splinting, and/or physical therapy, to oral medication that works against muscle stiffness, such as baclofen, injection of an anti-stiffness drug into the spine, intrathecal baclofen, and several types of surgery.
Right now, a new medical research study is underway for children suffering from spasticity due to cerebral palsy. The purpose of the study is to determine the safety and effectiveness of an investigational medication in treating lower limb spasticity in children with cerebral palsy. If your child is between the ages of 2 and 17 and experiencing spasticity in the lower limbs due to cerebral palsy, you're invited to see if he or she may qualify for this important medical research study. Before a medication is made available to patients, medical research studies are conducted to see whether the medication is safe and effective. Medical research studies must follow strict rules set by the Food and Drug Administration and must be approved by an institutional review board known as an IRB. All volunteers who take part in a medical research study are supervised by a doctor and other research professionals. The medication is referred to as investigational because it is still being tested to determine how safe and well tolerated it is.
If your child participates, you will be asked to complete a number of visits over the course of 12 to 28 weeks. Families may be reimbursed for their time and travel. During the course of the study, participants will receive the investigational medication being tested or a placebo, which looks like the study drug, but has no active medication.
I was never aware of medical research studies. I think this is something I'm going to talk to our doctor about right away.
If you are interested in seeing if your child qualifies for this important medical research study, you will be given detailed information on the study and the possible benefits, risks, and side effects of the investigational medication. A doctor will review with your family what you and your child will be asked to do. Once you have discussed specifics of the study with the doctor, you will be asked to review and sign an informed consent form. By signing an informed consent form, you indicate that you understand the information regarding the possible risks and benefits, and that you permit your child to take part in the study if he or she qualifies. When your child takes part in a medical research study, participation is voluntary. That means you have the right to take your child out of the study at any time. If you ever have concerns regarding the study or questions about the medical care your child receives, we urge you to talk with the doctor or a research staff member. You also may contact an IRB representative at any time. If your child is aged 2 to 17 and is experiencing lower limb spasticity due to cerebral palsy, please consider participating in this medical research study. Ask your doctor for more information on this medical research study and if your child may be eligible to participate. You can also visit spasticitystudyforkids.com to learn more.